So just talking about the person who wrote Alice in Wonderland had seizures as well, Lewis Carroll. And the very sensation of Alice falling down that hole is something that is described by people having seizures. They just have an abnormal sensation where they're falling or spinning. And in the description, and a lot of the descriptions within Alice in Wonderland, Carroll describes Alice as often feeling that her own body is shrinking or growing before her own eyes. And sometimes people do describe that. And Carroll himself actually recorded his seizures, and he also talked about these prolonged headaches and not feeling back to yourself for a prolonged period of time in his journals. So now shifting to seizures that affect the whole brain at the same time, generalized seizures. So generalized tonic-clonic seizures are the ones that we were talking about that you typically think of a seizure, someone falling to the ground and shaking all over. But then again, these sometimes can be non-convulsive, meaning the brain is doing it, but the person, like you might think they're in a coma or sleeping, but their brain is seizing. So convulsive seizures involve bilateral symmetric movement in an unconscious patient. There's the tonic phase, which is the tightening, and then the clonic phase, which is usually the stretching. Usually people describe tongue bite or cheek bite or blood in the mouth. There's bowel or bladder incontinence that may occur. And then there can be this postictal state where there's confusion, fatigue after the seizure. And in some patients, depending on what the underlying problem is, sometimes they can even have paralysis. They might not be able to move one side of their body for a period of time. But then it comes back when the brain has had enough time to relax and go back to its normal state. Absence seizures, again, a generalized seizure. These are what we call the staring spells that sometimes kids have. So people suddenly stop participating in their activities and then just stare as if they're frozen. They can have fine fluttering movements of their eyelids or lips, and they last seconds. They're very brief. And then they go right back to doing what they were, but they're amnestic for the period of time that they were having the seizure. And this can occur many, many times a day. And these are typically seen more in childhood. So kids who are complaining, or actually not kids, because they won't even remember what they're forgetting, but kids who are doing well in school that suddenly stop doing well in school, that their teacher is saying that they're staring off into space, not paying attention. These are sometimes what's happening in these kids. Myoclonic seizures are characterized by jerks. So, and we've probably all of us have had something like this, like when you're falling asleep and you're tired and you suddenly jerk. That's a myoclonic jerk. In of itself, it's not, it's just the body going in this relaxed state, and sometimes you have this abnormal twitch, but sometimes seizures can present that way. And it's like this brief shock-like contraction of muscle groups resulting in a twitch. And when you put an EEG on and people are having actual seizures with these, you see that they're associated with abnormal EEGs. Versus people, like if you just, sometimes like everybody, when they're falling asleep at some point or other has had a twitch. So those would not show an abnormal EEG at that time. Clonic seizures are ones that are characterized just by the jerking. They can be irregular, asymmetric movements, and the EEGs show a certain pattern of mixed large amplitude slow waves, and they can often be seen in younger populations, the babies, the infants, the young children. Tonic seizures is the stiffening with an alteration of consciousness. And there's no clonic or rhythmic phase. So people will just stiffen, but they won't shake. And then atonic seizures, sometimes kids who have these seizure patterns where they're having so many other types of seizures can also have atonic seizures where they just lose all tone and they just drop like a sack of potatoes on the ground. And these are usually brief, and they kind of just fall, loss of all tone in their body, but then they recover pretty quickly.